Good evening. This is Dr. Josh Goodwin. I'm going to be doing the webinar tonight here at the Regenexx Las Vegas clinic. As I said, my name is Josh Goodwin. I'm the doctor at Regenexx Las Vegas. I'm the one that's going to be talking about some of the spinal treatment options that we offer here at Regenexx Las Vegas. The kind of format is just me going through a little bit of history, talking about spinal pain, traditional treatment options that many people might be familiar with, and then go more specifically into some of the things that we do and our approach to treating spinal pain, injuries, degeneration. Finish up with kind of how we make decisions and the process of deciding if a person is a candidate for the procedures that we perform. And then at the end, have a little question and answer time. It is okay to write some questions down in the chat section or the Q&A section, just so you don't forget. I just may not stop to answer them when you write them down, but I'll go back to them at the end. And then at the end, there'll be some contact information about how to get a hold of us, how to come into the clinic, get scheduled, those kind of things for an evaluation. The goal of this is just to provide a format for education. So it's just to allow people to learn about options they maybe were not aware of for spinal treatment. We do have other webinars that we give for other conditions, a more general overview, knee treatment, these kind of things, but this one's going to be geared towards spinal treatment options. A little bit about my background. So I did grow up in Albuquerque, New Mexico. I did stay there for medical school. So I'm a medical doctor. I am board certified in physical medicine and rehabilitation. So I did my residency training in San Antonio, Texas. I'm fellowship trained in sports medicine and interventional spine. I've been with REGENEXX organization, which we'll talk more about, since 2015. I'm a co-author on review of different stem cell treatment options for low back pain and disc degeneration. So that's a little bit of my background. I am here at the REGENEXX clinic in the Regenexx Las Vegas clinic in Henderson. I did spend time at the Des Moines, Iowa clinic as well for about 3.5 years. So just jumping right into it. So spine pain. So it's very common. Many of us will have at least one bout of spinal pain at some point in our lives. And as you can see on the clinic, just looking about the cost that that we occur every year, just trying to treat patients, as well as some of the economic impact from lost work and wages. It's very expensive to treat. And looking at some of the interventions are also very expensive. So spinal fusions can be $100,000 or more. Discectomies can be very expensive. Not to mention other interventional things like injection-based therapies. It's always important to have at least a brief overview or foundation of what the anatomy is, and that's how we kind of look at things with deciding what's going on and what could be causing pain. So in your spines, we have our bony anatomy that comes from our neck down through our mid-back and low back. We have our vertebral bodies. These are connected through our discs, which are the cushions of the spine, our facet joints, which are the joints of the spine. We have our disc, which is the shock absorber, and our spinal cord, and the nerve roots, and the nerve roots that exit. So all of these kind of spinal structural elements we need to be aware of. There are other tissues that sometimes we forget. The spinal stabilizers include ligamentous tissue, which are like cables to the spine that hold segments together. And we have ligaments on the front of the vertebrae of the back, in between the back part of the spine, in between the spinous processes. And these are all the cables that help keep things stable. And we also have our control mechanisms with our muscles. And so these are also important stabilizers. And what we're going to talk about is a lot of our goal is we want to preserve the functional unit of the spine, as opposed to surgery being more of a destructive process, which sometimes compromises these muscles or stabilizers, and in part what can lead to long-term problems or repeat surgeries in the future. But our goal with what we do is to preserve the tissue. And there can again be different sources of pain, which gets back to the structure. So there's bony sources of pain, disc sources of pain. The joints, just like other joints, can have pain from arthritis or inflammation. We have the nerves within our back that can get injured, compressed, chemically irritated, and inflamed. The muscles can be injured through trauma, overuse, strains and sprains. Ligaments can be sprained and strained as well. And so the constellation of these things can be all a part of your overall pain pie and driving what your symptoms can be. Current treatment options, many of us are familiar. A big component is just lifestyle modifications. A lot of times we need to make sure we maintain our weight, we stay strong, we stay flexible, that, all of that is part of kind of a foundational treatment for long-term health of your spine. So it should be incorporated no matter what. But many of us are familiar with the different medications. So we have our anti-inflammatories, whether they be like ibuprofen, Aleve, or steroid medications, our strong pain medications like opiates, like morphine, hydrocodone, Percocets, our nerve pain medications like gabapentin and Lyrica, muscle relaxants. We have physical therapy and chiropractic. We have massage and acupuncture, different injection-based therapies, and different types of surgical intervention. And then obviously this is kind of more what people are familiar with. And then we'll talk more about what the Regenexx Las Vegas treatment options are. It's always important to understand that even simple things like taking an ibuprofen comes with risk. While it can be a good anti-inflammatory and help with some, arthritic pain or pain from injury or overuse, it does come with risk. It's associated with increased risk of heart attack, stroke, stomach ulcers, kidney dysfunction, and some people die as a result of these things every year. Opiates, as we all know, with the opiate crisis, there's always risks. While it can help with severe pain and sometimes is needed, it's best to be used in short duration, but it comes with risks of dependency, intolerance, and constipation and cognitive side effects. And so we have to be really aware of what we're taking, why we're taking it, how long we're taking it, and then trying to look for things that provide more benefit with less risk. Obviously, physical therapy can be helpful. It's a mainstay of what we feel can help. Even high-level athletes need physical therapy. So just because you're active in your job doesn't mean you can't benefit from physical therapy to work on imbalances, stabilization, restoration of your posture, improving biomechanics. Bracing can be helpful to a degree when things are flared up. There's obviously different injection-based treatments. More traditionally, these cortisone-based treatments. These are strong anti-inflammatories and they can improve pain short-term, but they do have some adverse effects over time. So if you're diabetic, they can increase sugars, they can cause weight gain, anxiety, flushing, and they are not healthy to your tissue. So especially with repeat dosing, they can actually accelerate degenerative process. And at least in menopausal women, it can increase the risk of osteoporotic fractures. So we have to be careful as far as how much and how often we're exposed to these different medications. These epidural steroid injections for back pain and sciatica and nerve irritation are done very common. Over 9 million per year are performed. And as I mentioned, exposure to just one epidural steroid injection can increase the risk of fracture in women by about almost 30%. You can also inject the joints of the spine for arthritic pain, but again, these medications can be locally toxic to cartilage cells, specifically if combined with long-acting anesthetics like bupivacaine. There's other pain procedures like radiofrequency ablations that kind of burn or heat up pain fibers, sensory nerves that innervate your joints, which can be helpful. And sometimes it's needed and sometimes it makes sense, but we have to remember that it's a destructive process. It's basically destroying the nerve input to the joint, which also innervates your deep back muscle. It's called the multifidus. And so you may have some segmental instability associated with that. And as I mentioned, our approach is more treating the full spinal unit and all those functional stabilizers. And so a lot of these options are more just targeting pain and blunting pain and not necessarily getting to the structural abnormalities. Obviously, surgery is sometimes needed, but because it's more invasive, because you're destroying and removing tissue or implanting hardware, it always is going to come with more risk and more potential downside. There's failed back surgery syndrome where you still have continued back pain, which can be as high as 49%. You can get repeat herniations after discectomy. There's chronic pain, additional surgery at levels above or below fusions like this. Obviously, infection, hardware issues, nerve injuries, and blood clots. So all of these things are potential risks and complications to more invasive surgery. So it's always good if you don't need it, and there's other options to pursue that to avoid the exposure to things that you can't go back from. And the Regenexx approach and our approach is more tissue preservation. What can we do to preserve, enhance the tissue that you already have without removing it or destroying it or burning it or cutting it out? And so the goal of what we do is to use less invasive procedures, which are all injection-based procedures, to avoid the more invasive surgeries. And we want to repair and stabilize tissue rather than remove or destroy the tissue. And we want to take advantage of just natural healing mechanisms that we know we have that can be utilized in areas that maybe are having injury or degeneration or inflammation. And so the Regenexx process, we'll talk about. Regenexx as an organization has been around since 2005, and it's always started with innovation and doing clinical research and then treating patients and tracking patients in a registry. We'll learn a little bit later that our registry has about 50,000 patients that we're tracking. And so we keep tabs on, different parts of the body, who's getting better, who's not getting better. And we try to use that to help guide our recommendations for treatment and then do publications based on a lot of that data. So more people can know about what's working and what's not working. And so this is really unique to Regenexx. We do have a large network. There's more than 60 locations around the US. This is one location that performs the regenerative Regenexx procedures. We do have technology, patents for lab processing, and a research and development team at our medical headquarters in Colorado. So Regenexx as a whole has treated more than 170,000 patients. As I said, we're tracking more than 50,000 patients in our registry, and more than 15,000 of them are with spinal conditions. And again, our approach is really kind of driving medicine and evolving care for orthopedic conditions, and in this case for spinal care. And as I mentioned, this is just a natural evolution, needle-based procedures, and we're utilizing the natural healing mechanisms of stem cells, platelets, and growth factors to help improve degenerative tissue. again, to help preserve it and reduce the risk for more invasive procedures. And so our approach is very comprehensive in looking at a patient. We don't want to just get suckered into just looking at, oh, you have a disc bulge, but how is that relating to everything else? What's the stability? What do the tissue look like? How symmetric are we? How are the nerves functioning? These give us an idea of structurally and biomechanically what's going on. And sometimes we need to help restore some of these things through different types of physical therapy means, restoring posture and symmetry as best we can, or performing procedural-based treatments to help get to the structure to help improve that, so then you can actually improve from the other less invasive options. As I had said, this is just to re-highlight that our spine is a functional unit. It's not just a bone or a disc. All of these things function together to produce the movements and allow us to do the things that we can do. And so we want to do our best to preserve and strengthen the tissue that is there that helps support our discs and our nerves and our bones, as opposed to surgery that kind of cuts through these things, which again, in some cases is needed, but if there is an option to help preserve it, then that's the way to go. So what are some of the things that we do? Again, everything we do is injection-based, it's minimally invasive, it's needle-based procedures. Some of the things that we inject are things that we can isolate from your body that are naturally involved with healing. And so one thing we inject is PRP, which we'll talk more about. We inject platelet lysate, PPP, and bone marrow concentrate. So these are things we're going to just talk about next. So within our bodies, within our blood, within our bone marrow, within our adipose, within your tissue, we all have things that are involved with healing and regeneration and responding to injury and maintaining our tissue. And so as time is involved and we've learned about these things, we've learned that we can isolate very specific cells, growth factors, stem cells that can be used, their properties can be used for tissues that are maybe failing us or injured or overused or inflamed. So one cell we use comes from the blood, which is called the platelet. When these are isolated and concentrated, that's what we call PRP, platelet-rich plasma. Platelets contain all of these different growth factors that are involved with cell growth, new blood vessel repair, collagen production, tissue repair, the formation of wound healing. So these are involved with activating the healing cascade. And so traditionally, PRP has been used for mild to moderate arthritis, ligament problems, muscle injuries in the back, disc pain from tears or degeneration, and nerve irritation. Platelet lysate is when we take these platelets and break them open to collect the growth factors specifically. Again, that's when we strip them. These are typically used around nerves. They tend to be more anti-inflammatory, and they can help improve nerve healing when the sheath is injured. They have anti-inflammatory properties. And typical clinics that just use an automated machine cannot make platelet lysate. There's more that goes into the process of lysing the platelets. And so we'll learn that we have kind of a manual flexible lab processing here, where we have a lab, a cellular processing lab, that's where we do everything as far as extraction of the growth factors. We also sometimes inject the platelet poor plasma. So after you take the platelets out of the blood, there's plasma left over. And this contains different growth factors that can stimulate healing, and it seems to be effective for muscle type injuries. And so we'll use it on occasion if there's some muscle type problems or atrophy that sometimes comes along with chronic back pain. And then last but not least are mesenchymal stem cells, which we isolate from the bone marrow. And so that's called bone marrow concentrate. Mesenchymal stem cells are found throughout your body, but one main reservoir is the bone marrow. And the nice characteristic about mesenchymal stem cells, when they're studied in the lab, is they can actually transform and they respond to the environment and can transform into different cell types, like a cartilage cell or a bone cell, for example. And so these can be used for some degenerative discs, disc tears, more advanced arthritic change of the spine. And so this is another option that we can use to treat the functional spinal unit if there happens to be some injury or pain. And this is just a summary, as I talked about, the different things that we utilize to inject into parts of the spine to help improve its function and try to reduce pain. And it really just depends on what's going on clinically, what's going on structurally, and what the symptoms are on what we would recommend. Do we recommend just growth factors? Do we need to treat more structures? Or do we need to move into higher level cellular-based injections? And so just looking at some of the data that has looked at utilizing cellular-based injections, platelets, growth factors, stem cell type treatments. This was looking at two groups, the platelet lysate group versus a steroid group, and looking at pain and functional improvements over time. So the platelet group did a lot better than the steroid group all the way through 6 months, and took a lot less repeat injections as opposed to the steroid group. And then we know it's a little bit healthier than steroids, which have some long-term risks. Again, there are some FDA trials going on now with growing out stem cells for low back pain and disc degeneration. So hopefully those passed all phases of the FDA approval, and that will actually give us more access to different types of treatments for spinal conditions. There is some data out there utilizing the bone marrow-derived cells from Dr. Patin. He actually has 5-year follow-up. Right here, 81% of people avoided surgery, and the average reduction in pain was 71%. So people did pretty well in this study. You know, the goal was to avoid fusion, which is a big invasive surgery. So 8 out of 10 people did, so that's great. There are some PRP studies, and there's some more that have been performed looking at PRP versus kind of a placebo, with the PRP group doing better in functional outcomes and pain through the first year of follow-up. Utilizing this is some of the platelet studies for the cervical spine, treating that functional spinal unit, and this was safe and effective for reducing pain and function through at least the first 2 years. And these are other studies that REGENEXX has published on using platelets or stem cells for spinal conditions, for treating the functional spinal unit, for treating lumbar degenerative disc disease, for treating irritated nerves in the back, for treating upper cervical instability, and into the disc. So these are all things that REGENEXX itself has published. And like I mentioned, we have our registry where we're always tracking patient outcomes. This is a little bit low. This is a little bit old, probably about a year old as far as the numbers. But even at this time, is close to 15,000 patients. It's a little bit over now. But we try to look at function, pain, and overall improvement of patients within the registry and put that on the website. So as I mentioned in the beginning, not everybody's going to be a good candidate for what we do. Some people need surgery. Some people just need therapy. Some people might be better with those other types of spinal interventions. And so the evaluation process is very important for helping decide who needs what and what kind of candidate you are for what we do. And anytime you're looking at any intervention into your body, and if you go to other clinics that perform similar types of things, make sure that you get educated, that they look at your imaging, they perform a physical exam, they give you some idea of what your potential for success is and let you know how they determine that. But the evaluation is important. Everybody we see for evaluation gets scheduled for at least an hour consultation. We do all the typical stuff like reviewing medical history, imaging. I like to show you your MRI show you what's going on at what level, tell you why we can help or why we can't help, and then just discuss options and answer questions, and give you an idea of what the overall chances for success are. We can never predict your specific outcome or your specific response to any treatment. But what we do is give you the averages based on the studies, our registry data, those kind of things. And we have that conversation to see, does it seem like it could be a good fit for your specific spinal issue? So for example, if someone comes in and they just have some pain radiating to their leg, and it seems to be coming from a disc herniation, but everything else looks pretty good, a lot of times we might just recommend the platelet lysate around the nerve that's irritated and at that area of disc herniation. This person would be considered a high responder candidate and may need 1 or 2 treatments. It's hard to predict exactly how many people need 1 or more, but that's seen over time. So we have a good follow-up process every 4 to 6 weeks to make sure you're getting better. Again, not everybody responds, and so that helps us understand if you're getting better, do we need to try something else? And the procedure is as such. So it's a 1-day procedure. This is kind of our lab setup where we can manually isolate and extract different cells. So you have to do a blood draw. We have the processing. Because we have a flexible lab platform, we can adjust dosing and concentrations based on your age, tissue type, location, and injury severity. And then we do injections around the nerve via X-ray guidance. In this case, this X-ray is actually of the left L4-5 level. It looks like we also did the S1 level down here, but this is showing just the contrast flowing around that nerve, and then we would follow that with the platelet lysate. Now, if somebody had more things going on, like some disc herniations, but they had a little bit of degeneration, they had some joint arthritis and a little bit of muscle atrophy of the back, that means we have to treat more comprehensive for the functional spinal unit that we talked about. This person would probably still be a high responder. We would probably want to use PRP for the joints and ligaments, the platelet lysate for the nerve irritation, and that plasma for the muscles. And kind of a similar thing, 1-day process, blood draw, processing, and injection. But there's more involved with what needs to be treated. We have to treat around the nerve or the disc herniation. The joints need to be treated. The ligaments need to be treated. And then the muscles need to be treated. So we use ultrasound to make sure we're injecting right where some of those muscle injuries are or that atrophy is. Now, kind of the biggest comprehensive thing that we do for more severe degenerative changes with disc herniations, disc height reduction, a tear of the disc, some irritated nerves, and some more high-grade muscular issues, then that's when we start to add in the bone marrow concentrate, which contains stem cells, and combine that with PRP, the platelet lysate, and the plasma for the muscles. And so it's still a 1-day procedure. The one thing that's different is we have to perform a bone marrow aspiration. It takes about 30 to 40 minutes. We can use twilight IV sedation, but people do well tolerating it without. We do a little blood draw and we process. Again, we can get elevated concentrations, get all the cells that we need, and then we'll do the injection the same day. As I said, bone marrow aspirations, people do well if you numb. And so in this study, almost 90% of people would do it again, had little to no pain, but you can make it easier by adding in a little twilight anesthesia as well. Now, again, there's more that happens in these cases. So you have more degeneration, more things to treat to help preserve the functional unit. So we have to get the bone marrow derived cells. Once isolated, the stem cells, the PRP, the platelet lysate, and the plasma, then we can do the injections. And so the nerve injections, the joint injections, the ligament treatment, the disc treatment, and again, that muscle treatment. So it's a very comprehensive type approach, again, trying to help preserve, improve the stability, and treat the spine as a functional unit as opposed to just individual pieces. And so post-procedure, typically 2 to 3 days of soreness. Most people will need some type of physical therapy. Some people get bracing, likely would need some type of pain medications for a few days if we're doing disc injections. For the first 2 weeks, we have some modified activity. It can change depending on what we're doing. And then we have follow-ups over time to ensure people are getting better. Some people do need more than one treatment over time. As I mentioned, it's hard to predict exactly what you might need, but it just depends on, you have to treat and reevaluate. But most people do pretty well with one treatment, but again, there's always some people that need more than one. And these are just some images that we have taken over time. So disc herniation, better after 2 platelet injections with PRP and platelet lysate, disc shrinking back and opening up the spinal canal, annular tears of the disc, so tears in the L4 and L5 discs sealing up after injection, disc herniations significantly reducing in size after a platelet lysate treatment and PRP treatment to this L4 disc herniation. So that's kind of getting through that pretty quickly, trying to walk through traditional treatment options, some of the things we do, how we make decisions, some example cases. Are there any questions that anybody has? I'll go to the next slide just in case people need to write down anything. But this is, you can reach out to Lauren to get scheduled for consultation or to send in imaging to see if what's going on in your spine. We do like to have MRIs when possible. That's the best way to make a decision. So here's the contact information for that. So people are asking, how much does it cost? So it really depends on what you're doing, whether you're doing just platelet lysate, PRP. The range can be as low as $1,200 and can be as high as like $5,000 to $6,000, depending on how many levels you're doing, how many discs or structures, and whether you're using platelets versus the bone marrow concentrate, which contains stem cells. That's the range, though. Most insurance companies do not cover these procedures at this point. As a caveat to that, however, REGENEXX is contracted with 1,200 to 1,400 self-funded companies that have added REGENEXX as a benefit to their employees. We're the only organization that perform these procedures that's been able to do that. And we're using that as a way, as a stepping stone to hopefully get more coverage. So unless you're employed at one of these companies, which you can reach out to Lauren to see if you are employed by someone that's self-funded, you can check to see if we are contracted with them. But that's one area of coverage. Outside that, it's self-pay. Let me see. So do I have to pay it all up front? We have different payment plans. We do work with United Medical Credit, which can help kind of break it up over time. And then internally, we can do payment plans as well, depending on what we're doing. And we can work with you on that as well. Does it matter how long a nerve has been pinched to whether it will have a positive outcome? So there may be some role in the longevity of the symptoms, but it really gets down to what is going on that's causing the pinching of the nerve. Is it just a soft tissue disc problem? Is it a bone spur? Is it collapse of the disc and that's kind of narrowing around the nerve? So it really depends not so much on the duration, but also what the cause is and the severity of the cause. How much space is there to actually place a needle? Can we get there safely without creating more problems? can we inject enough fluid and dosing to have a therapeutic effect? So it's not so much the duration, but what the source and the cause of the pinching of the nerve is. Really a good way to just kind of super simple to get a better sense of if things are going to be helpful, or if this is an option for people, is sometimes if you already have imaging, you just send them in. It's better to be within 12 months and I can evaluate them. We just do complimentary MRI reviews where if you send them in to say, is it worthwhile coming in? Is it not worthwhile coming in for a conversation? And in the end, even coming in is not, and talking, there's no risk to it. You come in, we do take insurance for like the evaluations. We're not contracted with everybody, but we're contracted with most insurances for like the evaluation and some of the non-Regenexx type procedures. So, and then even cash pay evaluations are $50. So it's not a lot to get in. There's not a big barrier or difficulty getting in just for a conversation to talk about your specific problem, to better understand what the potential is. We're pretty honest on where you fit as far as candidacy. Do we think this is a good fit, or do we think other things would be more beneficial? Our goal is to just educate you on what your options are, and then that allows you to make the best decision for yourself. Okay, great, Wendy, thanks. I'm glad that the rotator cuff tears are doing good. Any other questions on kind of spine specific questions? There is some preparation sometimes if you're on like blood thinners. Sometimes we have to be aware of that. We don't want to do an injection or treatment within 4 weeks of a prior steroid, corticosteroid injection or oral treatment. We like the non-steroidal anti-inflammatories like ibuprofen and Aleve to be out of the system for at least 5 days and 2 weeks after the procedure. And so those are some preparation things that people need to take into consideration. As I said, it's good to have imaging within 12 months. We prefer MRI if possible. Some people can't have MRI for one reason or other, so a CT scan can be used in place of the MRI. But x-rays are typically not enough to make a full assessment. Well, you have the contact information. You can always reach out to Lauren. She can get you in contact with me and help get you scheduled if you have more questions or want more precise information on your condition. Just reach out. I appreciate everybody taking time this evening to kind of listen. There was a little comment here. With my job, I've been bending a lot, in pain now, ligament. Okay, ligament flip, but with therapy is stable. Okay, yeah. Different types of maneuvers, especially repetitive things, can put stress on tissue. Obviously, therapy can get people back in play, and if it's just not enough, that's sometimes when injection therapies can be helpful. But not everybody needs to get an injection, right? There's a lot of things that can help get people feeling better and back to full function. Even with some level of degeneration, doesn't mean you need to do anything. A lot of us are going to have some level of spinal degeneration. If we took just 100 random people off the street without any back pain and just did MRIs on everybody, you're going to find disc bulges and tears and some arthritis and some degeneration. So it's not necessarily painful condition in and of itself, but sometimes it does become painful. And then that's when we try to intervene when we can. All right. Well, I appreciate your guys' time. We'll close out, let you guys get back to the evening. And again, reach out if you have any more questions. Thank you.